So there are some additives are added into the detergent. Okay, so that the detergent is even more powerful. Okay, soap normally we seldom use it for cleaning purpose now. For cleaning purpose, wash your hand, okay lah. But for washing the cloth, normally we'll use the detergent. Okay, so there are some additives are added to enhance the cleaning efficiency. Okay, so let's see what are the additives normally added into the detergent. Okay, so there are a few of these. Okay. Okay. So first one, okay, biological enzymes such as lipase and peptidase. Okay. You see here, biological enzyme. Okay. So this one is just now we mentioned already. Okay. So normally this one, the function is to remove protein stains. Okay, protein stains such as what? Such as the blood. No? Okay, huh? Second one, the additives are whitening agents such as sodium perborate and sodium hypochlorite. Huh? Okay, so actually is the whitening agent to convert the stain into colorless substances. Okay, please write down. Convert the stain into colorless substance. Okay, so that especially your uniform, right? Okay, white color. So sometimes if there are some stains, so you need to remove it. Normally we'll use the white the detergent with addition of whitening agent. After that, fragrance. Yeah, I think this one should be very straightforward, right? 8. Fragrance, okay. To the fabric, to fabric. Okay. You can see there are so many brands, right, for detergent in the market. Okay. Some they say that it is very a lot of fragrance. Sometimes it can remove the blood and so on. Actually, you can see there are different types of additives are added into the detergent. Okay, next, suspension agents such as sodium carboxyl methyl cellulose. Okay, so this is what is the function? Okay, to prevent the dirt, okay, to redeposit onto the cleaning fabrics. Okay, some stains already removed, right? Okay, during the cleaning process, but sometimes it will redeposit onto the fabric again. So this suspension agent is purposely to prevent this situation to occur. Yeah. So to prevent and okay. So we don't want the removed dirt to redeposit again to the clean fabric. So this is the suspension agent such as sodium carboxyl methyl cellulose. Okay, after that, last one mentioned here is anhydrous sodium sulfate and sodium silicate. Okay, so what is the function here? It's a drying agent. Okay, to keep the detergent dry by absorbing the water vapor. Okay, it's a drying agent actually. Okay, for this one, it'll be focused to the detergent in the powder form. In the powder form. If liquid form, no need to put in here. No need to put in this anhydrous sodium sulfate or sodium silicate because the liquid form already got water inside. For this one, will be focused to the focus to the powder form. We don't want the detergent in the powder form to become like stick together in a very large lump together. Huh? Okay, huh? So these are the additives, huh? Normally the popular one, okay, will be biological enzyme. This one is quite popular, huh? Yeah.
Okay, class. So how are you going to compare the cleaning effect of the experiment 1 and experiment 2, class? Hmm? So which one is effective, class? Which one is not effective? So you have to mention it. So this is how we compare. So we can mention soap, you can mention soap in experiment 1, okay, is not effective in hot water, okay, as cleaning agent, okay. But the detergent, okay, detergent in experiment 2, okay, is effective in hot water, okay, as cleaning agent. Okay, so this is how we compare. Okay, you can also use other sentence to compare as long as soap is effective. Soap is ineffective, not effective. Detergent is effective in hot water as cleaning agent. Okay, now explain why there are difference in the observation, class. So what are the key points that we need to mention, class? Can you type out some answer? What point you can write for this, class? Okay, so magnesium and calcium ions. Okay, scum and soluble salt. Yes. Okay, what else you can mention? Okay, basically the one mentioned or right by Kelvin is the one mentioned in the in the answer. You can mention it in the answer. So first, you can mention hot water contains magnesium ions and calcium ion. Okay. So this one you can write first. So after that, salt reacts with calcium ions and magnesium ions to form scum. Okay. Okay. Then detergent reacts with calcium ions and magnesium ions to form soluble salt. Okay. So here you can mention again. So detergent is more effective than salt in the hot water. Okay. Any question, class? Now see, I think which one is more suitable as a cleaning agent to remove the stains in the hot water? Which one, class? Very straightforward, right? Okay, this one is detergent, right? Okay, so detergent. Okay, huh? Any more question? Okay, huh? So next. Okay, next we are going to see the food additives. Food additives. Okay. So to improve its appearance, taste, or texture, okay. Number 2 is to preserve the food. There are two functions for us to add in the food additives. Okay. Now, how are food additives classified? That they are classified according to their function. Okay. So how many categories or how many category for the food additives? Okay. So please have a look here. Okay. So food additives, so let me see. Okay, first one is flavoring. Okay, flavoring. Second category is antioxidant. Okay, next. Okay, next will be dyes. Okay, dyes, or sometimes we call it coloring. Coloring. Okay, number 4. Okay, is a preservative. Okay, then after that is thickeners. Then finally is the stabilizer. We look into one by one. Actually, all are here already. Okay, so flavoring. If we look into the name, definitely we know what is the function. Okay, to enhance the natural flavor of the food. And then to produce the artificial flavor, and then to sweeten the food. Okay, there are 3 functions here. So sometimes during the food production, right? Okay, the taste for the food already lost, so they will add in some flavor into it to restore the original flavor. Okay, this is the first one. Okay, number 2 is during the sometimes, let's say, the production or making the cake, right? Banana cake or strawberry cake. Sometimes actually they do not put in the real banana or real fruits there. Okay, they will just use the flavor only. Use the ester actually. They are not using the real one. So this one also the food flavoring. And then for sweeten the food. Okay, let's see the example. Okay. So example, monosodium glutamate, MSG. Okay, do you watch Uncle Roger video or not? Anybody watch Uncle Roger YouTube or not? He always mention in the MSG, right? Ajinomoto, MSG. Okay. Every video he made all talking about the MSG. This is the monosodium glutamate actually. Okay. So MSG normally we add in like Ajinomoto is the brand. Is the brand. There are some other monosodium glutamate actually. Ajinomoto is the brand. One popular brand we will always see in the market. Okay. So where we can put soup, frozen fruit, food, meat, any vegetable or anything you want to make it more flavor, more tasty, put in MSG. Okay. Then next, just now I mentioned already the ester, ester, food flavoring cake, jam, ice cream. Sometimes during the production, they're not putting in the real one. They will just use the essence, the flavor only. And then they sweeten the food like aspartame. Aspartame. If you see this one, you know it is under flavoring. Actually, is to sweeten the food. Drinks, juice. Okay. So okay, next, antioxidant. Let's see, antioxidant. Okay, what is the function? To prevent the oxidation that causes the rancid fats and brown fruits. Okay, so this one is oxidation is the oxidation by oxygen, right? Okay, we learned already. So anti-oxidation, or we call it antioxidants, to prevent the oxidation actually. Okay, so example, ascorbic acid is a vitamin C actually. Citric acid okay, in the food like cake, biscuit, margarine, fruit juice, all this we put in the antioxidants. The natural antioxidant is very good. It can prevent you to getting older very soon. Okay, it will prevent you oxidized by oxygen quickly, meaning that you will stay younger for a longer time. Okay, so this is antioxidant. Okay, next is the dyes. Dyes is the coloring. Okay, during the food production, sometimes the color change, right? Okay, color change or becomes not nice. So you would add in the coloring to restore the color in the food. Okay, to make the food appearance look more attractive. Otherwise, the customer don't want to eat. Correct. So what are the examples? Okay, azo compound. If you see this azo compound, such as tetrazine, sunset yellow. Okay, if you see this example, it is under coloring or dyes. Okay, or triphenyl compounds such as a brilliant blue. Okay, blue now. For example, under orange juice and jam, all this. Okay. Okay, next, preservative. Okay, preservative is very popular in food additives. Why? It can use to prevent the food from being spoiled by preventing or slow down the growth of the microorganism. Okay, yeah, and then prevent the food from being spoiled by removing of water, retard the growth of the microorganism, and then prevent the food from being spoiled by providing acidic condition. Okay, preservative, okay, is used to prevent the food, okay, from spoiled easily, or you want to keep the food for a longer time. Understand? Otherwise, the food manufacturer, they will lose money. Understand? So that's why if they put in preservative into the food, okay, their food can last longer, and then the customer it has a longer period for customer to buy it or consume it. Then they won't lose a lot of money. Understand? So preservatives is very important for the food manufacturer. Okay, so there are this one prevent the food from or slow down the growth of the microorganism. Okay, example, sodium nitrate, sodium benzoate, sulfur dioxide, all these are preservative. Okay, then this one remove the water from the food or retard the growth of the microorganism. Okay, this one we use the salt, right? Like salt fish, salt egg, salted fish. Actually, is remove the water inside the fish. So without water inside, then the microorganism, okay, or bacteria cannot grow. Or sometimes sugar, you provide the very sweet medium then it will remove the water or retard the growth of the microorganism. Okay, for example, in the jam. And then another way is providing the acidic condition. In the very acidic condition, the microorganism also cannot survive. For example, you put in the vinegar, for example, the pickled fruit, okay, nuts, okay, you put into the container and then put in the vinegar inside, okay, then it can last longer time. Okay, any question you want to ask about this? Any question, class? Is that okay?
I think so.
Next, we look into this one. Okay, thickeners. Okay, thickeners is used to thicken the fruit. Thicken the food. Okay. For example, you see this one, acacia gum. Under chewing gum now. Pectin, gelatin now. This under jam, jelly, cheese cream, low-fat milk. Okay. Another one is the mushroom soup in the Pizza Hut there. Okay. That soup, right, is very, very thick, right? Actually, they put in the thickeners to thicken the food. Starch also can. You put in the starch when cooking, right? You put in some starch. You will thicken the food also. Okay. Last one is the stabilizers. Stabilizers improve the texture of the food by preventing the emulsion. Prevent the emulsion from separating out into the layer of water and oil to emulsify the food. Okay. And then to improve the consistency of the food by giving a firmer, more uniform and smoother texture. Okay, for example, lecithin, gelatin. Okay, here you see gelatin also can become the thickeners. Okay, but gelatin also can become the stabilizer also. Okay, especially the ice cream. Ice cream is a mixture of protein and water. Initially, if you mix them together, right, they cannot mix. Correct? But if you put in the stabilizer, they can mix very, very well. Okay? And then sometimes, if you see, sometimes a food, okay, initially they are very uniform, but after some time, the food is separate out. Okay, becomes two layers like that. Actually, this one is because of the no stabilizers. Okay. Okay, becomes two layers, especially when the water and the oils, they will separate out. Okay. Any question about these 6 food additives? Anything you want to ask? Anything you want to ask, class? No, what? Okay. No. Now, just now I asked you to prepare some food packaging, right? Okay. Any food packaging will do. Okay. I would like you to look into the food packaging, the ingredient part. Okay. The ingredient part. Okay. If you have, okay, I'd like you to spend roughly 5 minutes. Okay. 5 minutes. You look into the ingredients, and then can you classify the ingredients into focus the food additive part. Okay. Later, maybe I will ask you to list out 1 or 2. Okay. What is the category and then what is the example for your food? Food packaging there. Let's say you have a keropok. Okay, mami, for example. Okay, you look into the ingredient there. They are the main ingredient is not the food additive. Not the food additive. I will ask you to focus the food additive. Okay. Keropok, normally for the keropok, right? Definitely it has a MSG normally. Okay, you spend some time to see, look into the food packaging. You can go to search one if you haven't get any. The biscuit also can actually. 1A, what is the function of tetrazine? Should be tartrazine. Okay, what is the function, class? This question I would like to ask Tiffany. What is the function of tetrazine? Can you type your answer or on your mic? Tiffany? To dye the food, okay, as a food coloring, okay, all can, okay, add color to the food, okay, also can, just write in, okay, right, add dyes or add color to the food, okay, or you can make right as food dyes, also can, tetrazine. So remember this food additives, tetrazine. Okay, now B. How does the sugar makes the food last longer? Okay. How does the sugar, okay, make the food last longer? Okay. This question, okay. Clement, okay, what is your answer? What have you write for your answer? Yeah. Did you write any answer? You didn't write. Okay. You cannot find answer? Okay, how about Michelle? Did you write something? How the sugar can make the food last longer here? Michelle, did you write something? Yeah, any? Michelle? Or any other student? Did you write something? What is the okay, here, Michelle, right now, the sugar draws the water out of the cell of the microorganism and retard the growth of the microorganism. Yes, okay, correct. So actually, it can remove or draw the water out of the cells of the micro because it produces a very sweet medium. Okay, very good. Okay, so it draws the water out of the cell of microorganism and retard the growth of microorganism. Okay, so actually the salt also will do the same thing, same function, create the concentrated solution to slow down the growth of the bacteria. Okay, basically the sugar will draw out the water out of the cell of the microorganism. Okay, here, remove the water actually, and then retard the growth of the microorganism. Salt also the same, sugar also the same. Okay, good. Next, C. P and Q. Sodium benzoate under what? And then Q under what? Okay, this one I like to ask Valerie. Did you write something? P is what? Q is what? Valerie, did you write answers for this? C? P, preservative. Q? Okay, Q is the stabilizer. Okay, good, correct. Okay, so let's check. Okay, next question number 2. Okay, here mentioned to you V, X, Y, W, and Z. Okay, now what is or this, okay, V. Class, what is V? You can type your answer. Anybody? What is V? This one. Sodium nitrate, sodium chloride. Okay, V is preservative. Yes, preservative. Okay, how about W? W. Here, acacia gum. Okay, thickeners. Okay, thickeners. Actually, it can be stabilizer also. Oh, 2. Okay, that both can be accepted. Okay, how about X? What is X? Antioxidant. Example C. What have you read for X? Citric acid. Okay, can. Citric acid. Okay, what else? Ascorbic acid, right? Which is vitamin C now. Okay, how about Y? Y. MSG, octyl, ethanoate. Okay, how about Y? Aspartame, yes, aspartame can. Okay, another one is saccharin. Okay, it's a sweet sugar actually. Oh, sugar, sweeten the food. Okay, last one, Z, food coloring. Okay, how about example? What have you write? Okay, tartrazine. Okay, can. Coloring, right? Okay, tartrazine. Okay, azole compound, right? Okay, and then triphenyl compound also can. Also can. Okay, any questions so far? Can. Now B1, give one example of food that used to use sodium nitrate as a food additives. What food is that? Anyone you have read some answer for this? We use the sodium nitrate as a food additives. Anybody write something? Okay, sausage. Yes, very good. Sausage. Besides sausage, meat, right? Meat. Okay, burger. All this can be used. Can be used burger. Okay, explain how the sodium nitrate work as the food additives here. Okay. So, food additives here, sodium nitrate, how it works. Is it going to draw out the water? Okay. It slow down. Okay, slow down the growth of microorganism. Okay. And then actually, if you look into the notes just now, okay, yes, sodium it prevents slow down the growth of the microorganism. Sodium nitrate here. Yeah. Okay, sodium nitrate. Yeah. Okay. Next, suggest another example of same type of food additives as the sodium nitrate that used in the chili and tomato sauce. Okay, how about this one? Benzoic acid. Benzoic acid. Let's check. Benzoic acid. Okay, can. Sodium benzoate also can. This one. Chili and tomato sauce. Normally we use a sodium benzoate now. Sodium benzoate. Sodium. Okay, sodium benzoate. Okay, C1, give one example of food that use the sodium chloride as food additive. Okay. This one, sodium chloride is salt, right? Common salt. Okay, salt fish, salted fish. Right. Salted eggs, right? Any more? Okay. Now, how about how it works? This one is the removing of the water. Remove the water from the cell of the microorganism. This one same as just now, the sugar one. Okay, same as this one. It draws the water out of the cell of the microorganism and retard the growth of the microorganism. Same as the function here. Okay, D1, what is the function of Y as a flavoring agent? Y. Y is a aspartame, right? Aspartame. Okay. It sweeten the food, okay, with low calories. Okay. Now, what is the function? Side effect of MSG? Yeah? Okay. There are some research. Actually, they argue that MSG no side effect. No side effect means it's very good. They want to protect it. Okay. But for me, I think if you use a lot of MSG, it will be having side effect. Okay. Example. What do you think? If you eat a lot of MSG, what is the side effect? Anybody? You write something? Nosy? Okay. Any headache? Yes. Okay. What else? Headache can sakit kepala. Okay. Actually, another one I think. Okay. I agree with this. There is the falling hair. This one. Maybe you all still very young. Okay. You won't feel you feel nothing. Eat a lot of MSG. But if you getting older, right? Okay, you will see some, because some of my friends they like to eat the MSG and like mee segera. Mee segera inside there also got a lot of MSG. Mee goreng mee segera, all these things got a lot of MSG. And then the hair always is botak already almost. Falling hair, I agree with this. I don't know you agree or not. Okay. Now, next, what is the function of octyl ethanoate as a flavoring agent? Okay, this one, octyl ethanoate. Still remember this one? What is this? It's a ester actually, right? Okay. So octyl ethanoate actually is produced artificial orange flavor. Okay, so it's not down here. Produce artificial orange flavor. Not the real orange flavor, is the artificial one, not the real one. It's ester. Okay. Then another food additives that cause the children to become hyperactive. Hyperactive. Which one will cause a hyperactive class? Is the azo compound. Azo compound. Or triphenyl compound. Okay, but this one definitely got argument. Okay, got argument on it. Some research maybe say the hyperactive is not caused by all these things. Okay, but there are some research mention this, so we can write this one. So what is the function of Maxent class? So a Maxent is used to prevent or cure disease. Okay, or to relieve pain. This is the main function of the medicine. Huh? So what are the source of the traditional medicine? Traditional medicine is not that popular. Not that popular. Like aloe vera, bitter gourd, ginger, garlic, hibiscus, turmeric, tamarind, Centella asiatica, or this pagaga, gaga. So these are the traditional medicine. And then for Chinese, we have Chinese traditional medicine. Malays, you have Malays one, right? Okay. Iban, you have Iban's traditional medicine. Actually, a lot. So it's actually quite difficult for the question to ask the traditional medicine, the function and so on. Okay. So for this one, I'd like you to just note down the function. Okay, note down the function, and then normally it's not that popular in the SPM level. Not that popular. Okay. So this one, I would like you to just note down the function. Okay, you can see. Okay. So aloe vera, its juice is used to treat the skin wounds and burns. Okay. Let's say you accidentally burn your skin, right? You can use the aloe vera to treat it. And then some wounds, okay, you can use to treat it. Okay. Bitter gourd, fruits are used to treat diabetes, or diabetes. So it's very good, bitter gourd. Ginger, the rhizomes are used to treat stomach pain, improve blood circulation and digestion. Ginger. So it's a rhizome. Rhizome is used. So meaning that is the part, not the leaf. It's the rhizome part. Okay. How about garlic? Garlic, bawang putih, used to lower the blood pressure and also has antibiotic properties. Antibiotics. Okay, antibiotics property. Hibiscus, bunga raya. I don't know. It has it can relieve its leaf. It can relieve the headaches and hair loss or hair loss. Okay. Turmeric, treat pimples. Okay. Then tamarind juice reduce the coughing. Then this one's Pagaga Centella asiatica. Its leaves are used as a herbal tea to treat the pain and inflammation. All this. Okay. Actually, not more than this. Here's just a few examples, so you can note down first. Okay, our focus will be modern medicine. Modern medicine. Okay, finish already, class? Not yet. Okay, class, finish already? Yes, okay. So I can proceed. Okay, next, we want to focus to the modern medicine. So modern medicine are chemicals that are extracted from plants and animals or synthetic chemicals. Okay, so they are manufactured in the forms of liquid, capsules, and powders and tablets. Okay. Okay. So class, can you tell me what is the main difference between the modern medicine and the traditional medicine, class? What is the main difference? Traditional medicine and the modern medicine. Anybody know? Or anybody want to try? How to differentiate whether it's modern medicine or the traditional medicine, class? Or Kelvin, do you have any idea how to differentiate whether it is or what is the main difference between the modern medicine and the traditional medicine? No idea. Okay. If you can see, normally, okay, the modern medicine, the ingredient is very, very scientific. Okay, all the content, okay, it is scientifically identified. Meaning that how many percent is this ingredient, how many percent of it is that ingredient. Okay, and then it is undergoes the preparation of a very scientific preparation. Okay, compared to traditional medicine. Okay, let's say the aloe vera. Okay, aloe vera we just take directly, and then we use it to treat on the skin, right? Okay, so this one is a traditional medicine. So you can differentiate that. So what are the type of modern medicine? Okay, so modern medicine, analgesic, okay, antibiotic, and psychotherapeutics are 3. Okay, actually more than that. 1, 2, 3, 4, 5. 5 of it. Previously we have these 3. Another 2 antibiotics. Now no more antibiotics actually. They changed name already. The modern medicine, it has 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 5 categories. Okay, so we look into one by one. One by one. Okay, first one. Okay, we look into analgesic. 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 So example like paracetamol, aspirin, codeine. Okay, so the first modern medicine here. Okay, this one is the most popular one now. It is used to relieve pain without causing the numbness or unconsciousness. Means you still conscious now? Conscious. Okay, just relieve pain only. Okay, aspirin is the strongest one. This one is for very serious injury. Very serious injury. For example, accident. Okay. So use the aspirin. Okay. Next one will be paracetamol. Paracetamol is used to reduce the pain and the fever. Okay. And then this one, you highlight this. Paracetamol, it can be given to children and gastric patients. Okay. As it does not irritate the stomach. It is neutral. Okay. You write down it is neutral. Okay. And then children cannot take aspirin. Pregnant women also cannot take pregnant women cannot take aspirin also because it is very acidic. Okay, very acidic. It will cause the internal bleeding in the stomach. Okay, you note down. So aspirin it cannot be taken by children and pregnant women. Paracetamol can, because it is neutral. Then codeine is used to reduce the pain as well as to treat the cough and diarrhea. The correct way to use should be taken with a prescription by doctor. These are all the medicine actually need to prescribe by the doctor. Side effect, aspirin is acidic and can cause the internal bleeding and ulceration. So it is not suitable for gastric patient. Pregnant women, baby, children, all cannot. Then overdose of paracetamol can cause a liver damage. Actually, all the medicine, modern medicine, if you take excess, it will cause the liver damage because liver its function is to excrete all the unwanted chemicals, etc. If you keep let the liver work, overwork, then it will damage. Okay, then codeine may cause drowsiness when it is taken. Misuse of the codeine can cause addiction. Okay, any question you want to ask about this analgesic? This is the first one, and then very, very popular in the modern medicine. Any question? No response meaning okay, Okay, next. Antimicrobials, okay. Previously, we call it antibiotics. Here, antimicrobials, okay. So, antibiotics is under here, under this category. So, antibiotics such as penicillin, streptomycin, okay. Antiseptics such as hydrogen peroxide, iodine, ethanol, this one is antiseptic. These infectants such as ethanol and formaldehyde, okay, this is under antimicrobials. So the function to kill the microorganisms such as bacteria, viruses, fungi. So antiseptics slow the or stop the growth of the microorganism externally and help to prevent the infections. Okay, I think now the hand gels, right, is under this one antiseptic actually. Now, wherever we go out, we will use the antiseptic hand gel, right? Antibiotics kills and retard the growth of the bacteria. There's disinfectants destroy the microorganism on non-living objects such as a public area and building. This one also disinfectants. This one normally they will use it for spray, right? Okay, in the supermarket. Correct. Okay, they will spray disinfectants. So correct way to use antibiotics should be taken with a prescribed by a doctor. And then for antibiotics, the patient must take full course of the antibiotics prescribed by a doctor to make sure all the bacteria are killed. Otherwise, the bacteria may become resistant to the antibiotics. This one you highlight, put a star here. You must take full course of the antibiotics to make sure all the bacteria are killed. The side effect cause the headache, allergic dizziness. Then patients who are allergic to penicillin need to inform the doctor during the medical consultation. So this is under antimicrobials. Okay. Next will be psychotic drugs. Psychotic drugs. Okay. Okay, for this one, psychotic drugs. Okay, example: haloperidol, chlorpromazine, and then clozapine or clozapine. Okay, the function: antipsychotics are used to treat the symptom for mental illness that cause the personality change and insensitive to reality. This one for mental illness patients. Okay, the correct way to use should be taken with prescription by doctor. Side effect: cause the drowsiness, possibly leading to weight gain after prolonged usage, uncontrol of muscle movements of jaws, lips, and tongues. Okay, so this one, antipsychotics. This one is like for psychic mental illness one. Okay, any question? This one for the real one. Real mental illness one. Okay, to help the patient to live in the real or normal life. Okay, normal life. Okay, Next, anti-allergy, antihistamines. Okay, the function to prevent and treat nasal stuffiness. Okay, sneezing, itchy, and runny nose. Okay, this one for allergic one. Decrease the inflammation and swelling from other types of allergic. Okay, correct way. You can see all the medicine should be taken with a prescription by doctor. Side effect: dizziness, dry mouth, and throats, blur vision, and constipation. Okay, constipation. Okay, next, corticosteroids. Okay, so you can see betamethasone, valerate. Okay, reduce the inflammation and treat the asthma, allergic, arthritis. Side effect cause osteoporosis, hypertension, diabetes, weight gain, thinning of the skin and bruising easily. Okay, this one, corticosteroids. Oh, okay, for asthma, allergic, arthritis. All these are for normal person. We seldom see all this medicine actually. Okay. So these are the 5 categories of the modern medicine. Okay, this one is more popular compared to the traditional medicine. Especially I mentioned to you just now. If you see this one for analgesic, the aspirin is why it cannot be taken by pregnant women, children, or gastric patient cannot take because it is very acidic. So they should take paracetamol, because paracetamol is neutral. For this one, antimicrobials. Okay, inside this one, antibiotics should be taken full course or finish all. Why? Because to make sure all the bacteria are killed, otherwise the bacteria may become resistant to the antibiotics. Actually, in the reality or in the market, there are actually not many type of antibiotics are found. Okay, although maybe the brand are different, but actually the antibiotics maybe just few types only. So make sure that antibiotics if can, don't take. If really need to take, make sure that it is completed full course. Otherwise, if the bacteria is resistant to the antibiotics, meaning that in future same type of antibiotics are no longer effective to cure the disease. You need to find another one, the stronger one. Then it will be a big problem for you.